Hello dear friends. So today we're going to discuss about very common disorder. Nowadays, people coming to visit OPD for their consultation regarding hair fall. That is, we medically called as alopecia. So there have been different causes of alopecia, that is hair fall. So treatment ultimately depend upon which are the causes. So we have to consider for the we have to make strategy regarding their treatment. So there have been certain causes which are prominently often seen in the care patient. Sometimes, hair fall is sometimes due to hereditary, and which often we called as um, androgenic alopecia. In the case of androgenic alopecia, there have been male type of baldness. Often see that hair has started falling from the sides in male cases, and from central side, that is central thinning in the female patient, that is hereditary. So most of the uh, cases we often see the family history as well. The next important clinical term, that is telogen effluvium, is a very common thing where the people suffering, the patient is suffering from some psychological stress, and in some cases there have been some of uh, patient that are taking certain kind of drugs, that is medicines, but they're different kind of illnesses. After that, due to this medication of different illnesses, their hair gets started falling. There have been certain conditions, if there's been certain kind of a trauma that has been happening to the scalp or head, this may be one of the cause for the hair falling. So another important disease, I will say disease, because these are the patient now increasing so vastly, and at that time, particular time, treatment is really necessary, and which is called as alopecia areata. In this case of alopecia areata, the patient will come to us is there has been a lot of one spot in the scalp. There have been patchy area of hair fall is there. So complete loss of in certain patches of hair. So this kind of picture that we often see in this alopecia areata. So these patches also often see in the beard as well, in the mustache. So after that, alopecia totalis is also there. In this case of whole uh, hair getting loss of scalp, and the third term is called alopecia universally. In this case, whole body hair getting loss, the whole body baldness. So, in this condition is considered to be autoimmune disorder. In the case of autoimmune disorder, where the your immunity start reacting as a foreign substance and reacting to against your uh, hair cells. So again, next again important causes are there. There's been if the patient is suffering from certain systemic illnesses like cancer, like rheumatoid arthritis. In also such cases, hair start getting fall. If the patient is having taking chemotherapy, this is very common phenomenon to they are suffer from the baldness. Again, in some cases, there has been fungal infection of the scalp, that is tinea capitis, that is very common nowadays. Often we often see the cases that these also causes hair falling. Again, there have been certain clinical term nowadays, that is trichorexis nodosa. It is a clinical term where the lot of the structure or structure of hair gets thin due to most of the people in the cosmetically they are using a lot of hair dryers, hair ironing to stretch the hair, and due to this kind of intervention, the hair gets they normally they become lusterless, and they become brittle, and they start falling. So definitely treatment will decide upon which are the causes are from which patient is suffering from. So we have to consider all these causes, and accordingly we have to treat these cases. So self treatment, because I have seen some patient they are using minoxidil in so many cases. They are using minoxidil oil for since very long time, and some of them are using this finasteride kind of a tablet they are using. But this will depend upon which are the causes are behind your hair fall. So don't do self treatment. If it is there homeopathically, you can think of Arnica montana hair oil. This is very effective hair oil that you can think in the primarily you can think. After that, if still you will not get better, then definitely you have to consult the physician. So before you consult physician, you make sure that all these things, whether which kind of cause we are fitting. You can even correct your diet as well, because sometimes nutrition deficiency may be lead to hair fall. We also have this kind of patient. For that, we have to take proper nutrition, balanced diet. You also take some multivitamin tablet for some time, and you see whether you are getting better or not. If still this is persist, then definitely you have to consult proper doctor. Homeopathically, we can treat definitely alopecia areata, alopecia totalis, alopecia universalis. All the cases is definitely treatable with homeopathy without any side effect. If at all you go for all the modern therapies, then there has been definitely the corticosteroid they are using for so many cases, and which left lot of side effects towards your body. So decide yourself to which are the factor is responsible for your hair fall. So I think this video is helpful for you. So thank you so much.